student nurse from Davao Doctors College, and today I am going to demonstrate the parenteral administration, such as the intradermal, subcutaneous, and intramuscular injection. So this demonstration is a medication that enters the body by injection through the tissue and circulatory system. So now for the intradermal injection, check for the doctor's order on the patient's chart to ensure the medication of the client, then greet the client appropriately, introduce yourself, verify the client using the two identifiers such as his or her name, then birthday, then ask how the client and how he or she would like to call during the assessment. Then don't forget to establish a good rapport so that the client won't feel uncomfortable during the assessment. Then explain the procedure to the client on how he or she can participate during the assessment. And don't forget to provide the opportunity to the client so that he or she can raise for his or her concerns. Then of course, don't forget to perform hand washing to prevent the spread of the microorganisms, observe the appropriate infection prevention. Then arrange the medication drug to the hypodermic tray with the corresponding drug so that we can prevent the confusion later on. Then apply clean gloves to reduce the risk exposure to the blood. So it is important to ask for the patient's consent before entering the room. Hello ma'am, good day. So by the way, I am Franz, your student nurse for today. May I know your name? When is your birthday? Okay, so if that okay, then I'm going to check for your wristband. So by the way, the procedure that I will be doing is that I am going to administer the medication through intradermal injection. So ako ang itusok din sa inyo ang panit sa inyong kamot. So this is for us to know if you have any allergies or to test for your sensitivity. This may hurt a little, but I want you to not to move when I am injecting. Is that okay with you? Okay. So do you have any clarification or concerns, or do you want to relax before doing the administration? Okay. So as you can see, I've closed the curtain so that there are no other people who can see us during the medication, and the information that I will be getting from you is secure the safety handed to the doctors. So let's start the assessment. Okay. So now choose an injection site that is free from lesions and discolorations below the antecubital space, and one hand above the wrist. So position the patient's arm so that his elbow and forearm are supported with the flat surface. Apply clean gloves. Then use an antiseptic swab to clean the site beginning at the center in circular motion outward, about 2 inches and 5 centimeters. So now remove the cup and hold the syringe between the thumb and forefinger of your dominant hand. Then level the needle pointing up. Then stretch the skin tone at the injection site by pulling gently by the thumb and the forefingers at your non-dominant hand. Pull the needle at the patient at very close, then insert it slowly at 5 to 15 degree angle until you feel the resistance. Then slowly inject the medication and feel the resistance. Then withdraw the needle at the same angle and pat it with a dry cotton ball. Don't forget to do not massage the area. Then encircle the wheel with the blue or black pen. Then instruct the patient to do not rub the wheel or erase the mark. So ma'am, do not erase this mark, ha? So now assist the patient into a comfortable sitting position. So now ma'am, it is all done. So don't forget to do not recap or use again the needle. Discard the needle and the syringe to appropriate receptacle. Then wash your hand and document the procedure. Okay, so how's your hand, ma'am?
Okay lang, ma'am.
Okay, so may I see your hand? Okay. So sa ako nakita no, wala man siya nagpula. So that means that you don't have any allergies. So that means that it is all good.
Thank you, ma'am.
Hello, ma'am. Good day. So by the way, I am Franz, your student nurse for today. May I know your name? When is your birthday? Okay, so if I get an check for your wristband. Okay. So the procedure that I will be doing, ma'am, because you are unable to take the drug orally, we are going to take the medication or your medication into subcutaneous injection. So, do you have any clarification or concerns, or do you want to relax before doing the administration? Okay. So as you can see, I've closed the curtain so that there are no other people who can see us during the medication, and the information that I will be getting from you is secure the safety net for the doctors. So let's start the assessment. Okay. So now let's determine which site we'll use. Inspect the area for the bruising, inflammation, and edema. So palpate the site to avoid any area that is tender. So to make sure that you have the right size of needle, use your thumb and forefinger to grasp a skin fold of tissue at the injection site. So measure the fold from top to bottom and check that if the needle is about half long. So place the patient into a comfortable sitting position and ask the patient to relax to the area that is about to inject. So ma'am, just relax. So don't forget to apply clean gloves and clean the site with antiseptic swab. In a circular motion, starting from inner to outward. So now let's remove the needle cap by pulling it straight long. So hold the syringe with the thumb and forefinger with the dominant hand as you are holding a dart. So insert the needle quickly at 45 to 90 degrees. Then release the pinch skin. Then rest the dominant hand of your patient. So move your dominant hand at the end of the plunger and slowly inject the medication over several seconds. So retain your grasp on the syringe to keep it still. So quickly withdraw the needle. So place a swab gauze on the pad on the site and apply it gently. But don't forget to do not massage. Then place the patient into a comfortable sitting position. Then document the procedure. Then record the time and the amount of the drug onto the medication sheet. Hello, ma'am. Good day. So by the way, I am Franz, your student nurse for today. May I know your name? When is your birthday? Okay, so if I'm going to check for your wristband. So the procedure that I will be doing is that I am going to administer the medication through the intramuscular injection because this allows the medication to absorb quickly to your bloodstream. So is that okay with you? So do you want to, so any clarifications or concerns, or do you want to relax before we're going to the administration? So as you can see, I close the curtain so that there will be no other people who can see us, and the information that I will be getting from you is secured and safely handed to the doctors. So let's start with the assessment. So now let's proceed to the medication. So select the appropriate site for the injection. So valgus lateralis and the deltoid muscle are the possible area for the IM injection. So examine the integrity in the patient muscles mass. Then palpate the area for tenderness or not suitable for the injection. So inspect the area for the bruising, inflammation, and edema. So if the skin shows bruises or inflammation, use the other side. Then help the patient to sit comfortably and expose the area that only for the injection. Now disinfect the injection site in a circular pattern from inner to outer for about 2 inches. So now hold a cotton swab from the third and the fourth finger of your non-dominant hand. Then now remove the needle cup by pulling it upward. Then hold the syringe from your thumb and forefinger like you are holding a dart. So place the ulnar side of your non-dominant hand by pulling it just below the injection site. So hold this position until you pull the needle. So now, with your dominant hand, quickly pierce the muscle at 90 degrees angle to the skin. So continuing, pull the skin taut with your non-dominant hand. So aspirate the syringe by pulling up the plunger with your dominant hand. If the blood appears, use another side and discard the syringe. If no blood appears, then proceed. Then inject the medication in 1 ml at 10 seconds. Then wait 10 seconds and slowly withdraw the needle. Then now release the skin and place the cotton. Apply it gently but do not massage the area. Then now place the patient into a comfortable sitting position. Then document the procedure.